Good afternoon and welcome everyone to using the DSPT for the first time. My name is Alan Wilmot and I'll be running through the session on behalf of the Better Security, Better Care team this afternoon. But before we start, I'll just wait for a couple of moments just to allow anyone who's having difficulty to log in to be with us, and then we'll kick off with the programme proper. Okay, so let's make a start then. So before we start, just a few key points that we'd like to make about the session this afternoon. So just to remind people, this is a session that's aimed at social care providers who have never published the DSPT in the past, although of course everyone's welcome to the session, but it will be focused on social care providers. The session is being recorded, but attendees are on mute and can't be seen. The reason we record the session is so that we can then send it out to people who have attended. And if you do have questions as we work through the webinar, then please do feel free to ask them. But if we could ask you to use the Q&A function rather than the chat, so it doesn't interrupt the presentation. And if you're watching on a phone, then you need to tap the screen to see the controls, choose more, and then Q&A. Any questions that do come through that we're not immediately able to answer, we will come back to you if you add your email to the Q&A question. In terms of timing, the webinar will last for no more than 1 hour, and you will, as I've said, get access to the recording and the presentation, including the links. So let's have a look at what we plan to cover this afternoon. So we're in welcome and introductions. And we will shortly be asking you to complete a short poll just to get an idea of who's with us this afternoon. Then we'll be moving on to look at the registration process, how you complete the DSPT, how you publish it, and what support is available from the Better Security, Better Care programme will be a theme running throughout the webinar. But before we move on, just a quick reminder, please do use the Q&A, not the chat, for your questions. Okay, so as I said, we would like to run a quick poll just to get a view of who's here. And if you are a social care provider, we would be grateful if you could just respond to the questions that will appear on the screen. And it's just a process of clicking on the appropriate answer, and then we will have a look at the results of those. So I'll give you a couple of minutes just to work through those questions. Okay, so when the results come up, we'll have a quick look to see where people are at in terms of their DSPT journey. So, in terms of who's here this afternoon, is your service already registered on the DSPT? We have about 63% of you have said yes, 25% of you haven't started on the DSPT, and 13%, so it's about half and half in terms of people who are new to DSPT and people who have seen it before. Those that have registered, have you started to complete? Again, it's the same kind of percentage. And in terms of how you would describe your organisation, so we've got exactly a 50-50 split between multi-site care groups and single-site service. And I'll explain why that matters as we move through the programme this afternoon. So into the programme proper, and as a quick reminder, what we'd like to do is just to show you a short video which highlights the benefits of the DSPT for your organisation.
Better security, better care with the Data Security and Protection Toolkit. As a care provider, you store and share important and often sensitive information. This includes data about the people you support, their family and carers, through to staff, partners and funders. To store and share that information, whether it is on paper or digitally, all care providers must have systems in place that reduce the risk of cyber attacks and information breaches. If you don't, your business and reputation could be at risk, and you could be breaking data protection law. The Data Security and Protection Toolkit, or DSPT, is an online self-assessment tool. You can use the toolkit to check your data and cyber security policies, procedures and practices, and demonstrate that you have good systems in place. This can reduce the risk of a data breach and the risk of a fine if a breach occurs, as you will be able to show the Information Commissioner's Office the steps you were taking to reduce and manage risks. All adult social care providers in England, regardless of size, service type or ownership, should complete the DSPT at least once a year. When you have completed the toolkit, you can publish and share information about the standard you have reached. So what levels can you reach on the DSPT, and what do they mean? There are currently 3 levels on the DSPT. Approaching standards means you are meeting minimum legal standards. It's a temporary stepping stone to the next level, and you will need to produce an action plan to show what you will do to get 2 standards met. Approaching standards also enables you to get NHSmail, an accredited secure email system which helps you to share confidential information with local authority, NHS and other colleagues. Standards met is the level you really need to reach. It demonstrates that you are going above basic legal requirements, and it helps you to take some proportionate measures to protect you from cyber criminals. It will help you to reassure people who use your services, their families, and your staff that you are managing their information safely. It will also enable you to answer the Care Quality Commission's questions about managing data. And if you are accessing NHS patient data or delivering services under an NHS contract, you must have reached standards met. Local authorities are also increasingly asking for the DSPT in their contracts. Standards met opens up access to shared systems with other health organisations, including GPs, hospitals and pharmacists. These systems can improve decisions you make about someone's care and save your staff time. Finally, standards exceeded indicates that you have gone beyond required standards. So, for example, you may have Cyber Essentials Plus in place. As a care provider, you should complete the DSPT at least once a year, but we know that not every care provider feels confident about using the toolkit. To support you, the NHS-funded Better Security, Better Care programme provides direct support, as well as useful guides, templates and a helpline to enable you to publish your DSPT and to protect the vital information you store and share. To find out more, visit www.digitalsocialcare.co.uk/Better Security, Better Care.
Okay, so the video there gave an overview in terms of the benefits of the DSPT. Let's move on to look at more specifically how you do it and what it's about. So this diagram indicates the DSPT journey. So the first thing you would need to do in order to complete the DSPT is to register on the DSPT, and I'll be running through how you go about that shortly. And then you would complete either 26 questions that are marked mandatory. However, that will only allow you to publish at approaching standards as indicated in the video. The aim should be, I would suggest, to answer all of the 43 questions. It is actually, although on the slide it says 42, they have recently added an additional question. That will enable you to publish at standards met, which will give you the opportunity then to benefit from all of the digital solutions that are coming on stream. Having published your DSPT, you will need to republish it on an annual basis in order to remain compliant with the toolkit requirements. And if you do publish at approaching standards, then you will be asked to publish a action plan, which will indicate how you plan to get to standards met. So you can only publish at approaching standards on the one occasion. So when you go back to republish, it will require you to answer all of the questions. So we will cover all of those in detail as we work through, but please remember that once you start your journey, you're not alone. There is support out there available to you. And so if we look at what support is available, the Better Security, Better Care is the official partner of the DSPT, and the programme of Better Security, Better Care is paid for by the NHS, and that includes guidance and templates, etc., that are available for every aspect of the DSPT as you work through. There is also local support available from the 28 local support partners across England. And then, of course, there is the Digital Care Hub website where all of the resources are stored and available to you. All of this help and support is free and it's official. And that includes online guidance, step-by-step films, the webinars and the recordings of the webinars, etc. So please don't feel that if you come to a section in the DSPT that you find difficult, that you're on your own. There is lots and lots of support available to you. So another key reason for completing the DSPT is CQC. And those of you familiar with the recent changes in CQC will have realized that they are increasingly expecting a good provider to comply with the Data Security and Protection Toolkit. And indeed, it is now a requirement under the new single assessment framework. If you look under well-led and the section under governance, management and sustainability, there is a specific question relating to whether or not the organisation has completed the DSPT. So it makes perfect sense for all organisations to work towards achieving standards met on the DSPT. So that's the context for why you need to complete the DSPT. Let's have a look at how you actually go about it. And as I said, when we looked at the diagram, the first thing you need to do is to register. So how do you go about registering? Well, the first thing you need to do is to find your ODS code. Your ODS code is a code that's allocated by the NHS. It's Organisation Data Service Code, and basically it's a unique identifier for your organisation and your location. So every provider will have at least 2 ODS codes. So you will need to choose which ODS code to register with, and I'll talk more about that shortly. Having got your ODS code, you need to register, and that's a simple process of providing a name and an email address. They will then send you an email with a link enabling you to access the registration process, where you will be asked to set up your password for accessing the DSPT in the future. So what about ODS codes? How do you decide which ODS code to use? Well, if you are a single site, so a standalone care home or home care agency with only one CQC registered office, then you will still have 2 codes. You will have what they call an HQ code, but you will also have a site code or a location code. The location codes usually start with V, and if you are a standalone service, then you should register with your V code and ignore the HQ or A code. If you are a multi-site organisation, so for example, you might be a group of care services that share the same policies and procedures, and that's quite important because if you register as an HQ, and you register on behalf of your services, then it's important that they all have the same arrangements for information governance within the organisation. So it is possible in that instance to register with your A code, and then the registration can cover all of the sites under that particular organisation. So if you are a larger organisation, a multi-site organisation, for example, and perhaps offering more than one type of service, so you might provide care homes and home care, supported living, etc., then that becomes a bit more complex, and it depends upon what your business arrangements are and how you've registered with CQC as to what you can do and how you can register and which ODS code is the most appropriate code to use. So in that instance, if you are a larger, complex, multi-site organization, then we would suggest that you seek advice from the help desk, either by calling the number that's on the slide there, or by contacting the Exeter Help Desk on the email address that's also on the slide there. If you are a multi-site organization and you have previously looked at the DSPT, there have been some changes in the recent times. And you can see that the diagram that's on the right-hand side of the slide there will give you the option to select the services that you wish to publish for. You can also, if you wish to allow access to your sites to the DSPT, you can add your registered managers as viewers or auditors of the HQ publication. But however you've arranged your DSPT publication, you will need to revisit and republish on an annual basis, and you will need to check that the sites that are covered by that registration are still appropriate, etc. However, if you are still confused about ODS codes and you're not sure which ones will apply, it's quite easy to find your ODS code on the ODS portal. And the ODS portal is available on that link that's on the top of the slide there, or you can just search for ODS portal in your search engine and then choose Organization and Practitioner Search. If you can't find which one, if you can't find your ODS code at all, or you're not sure which one to use, then please do contact the Exeter Help Desk, as we've indicated on the slide there. They can help to unravel what you need to do and how you need to do it. However, it may also be that when you search for your ODS code, you notice that there's several entries for the same service. Look for the one that's marked open, because if you've changed your business arrangements or your registration with CQC, it will close one ODS code and republish a new ODS code. So look for the one that's marked open. Okay, so where do you start with your DSPT? So in order to access the toolkit, you go to the web address DSPT Toolkit NHS.uk, and you can see on the slide here in front of us that you've got two options marked by the red circles. The first of those is Organisation Search, and that's where you can actually check whether or not your organisation has previously registered or published the toolkit, in which case you won't be able to register anew. You will need to arrange to have that transferred to your new login details, etc. However, if it's not been previously registered, you can click on the register link and that will take you through to the registration process. Again, if you have difficulty, you need to contact either your local support organisation or the Exeter Help Desk, and they will be able to sort out the arrangements for you. But once you're through to the registration portal, you'll be able to see what we've got here. And the first thing it will ask you to do is to set your organisation profile. So you need to choose the appropriate sector for your organisation and provide key roles within your organisation and whether you have any relevant certifications. So these questions are not compulsory, I would suggest, except for the social care. So you would need to choose social care, and the reason I'm suggesting that is because as a social care organisation, when you click on that, it removes any questions that are not relevant for a social care organisation from the assessment as you move through the process of the DSPT. And I would just want to stress at this point that once you're into the DSPT, you can go back into any part and update it and change it at any stage later. So you can access all of the DSPT at all stages, including your organisation profile. So if there are changes, there's nothing there to prevent you from updating and implementing those changes on the toolkit. The sorts of questions it will ask when you register your organisation and set the profile is whether you've got a data protection officer, a senior information risk officer, a Caldecott guardian, and who is your information governance lead. You don't need to respond to any of those questions if you don't know or don't want to commit to having those roles within the organisation. It won't prevent you from continuing to the assessment. So you can select not sure or leave them blank, and it will still enable you to progress to the next stage. As the admin person for your particular DSPT, it gives you the opportunity to set up other users. So as administrator, you can manage users, add and edit evidence, and publish the DSPT, but it's also possible to add other people as members of your DSPT who can then add and edit the evidence but not publish. And it's also possible to allocate some people as viewers, in which case they can view your DSPT but not amend any of it. And again, if you're a multi-site organization, this is where it might be useful to add your registered managers, etc., as members, which will allow them to look at your DSPT and edit, or you may feel it's only appropriate for them to be viewers. However you wish to arrange that is entirely up to you, but it's quite helpful to have more than one person who can access the DSPT, particularly with the level of turnover in social care, etc. So if you have any difficulty with registration, there is support available to you. So again, you can visit the National Help Desk. There is also guidance available on the Digital Care Hub website, or I would recommend contacting your local support partner or your LSO. And as I say, there are 28 of those across the country in terms of helping you through the process. Indeed, they can even help you to find your ODS code should you wish to. Okay, so I'm going to stop at that point and just allow for any questions that may have come up on the registration process before we move into looking at the detail of how you complete the DSPT questions. Any questions coming up there, Rihanna?
Alan, do you want me to type the answer to about uploading evidence, or is that something that you wish to demonstrate as you go through?
I'm not sure what you're asking there, Claire.
There's a question asking how they upload the evidence on some of the questions. It has a comment section and asks them to tick the below evidence item. It also asks to tick to confirm evidence entered for the assertion. Do you want me to type an answer, or are you going to go through
You can type the answer to that one. Yes, thanks,
no problem.
Claire. Yeah, and I'll be running through the type of questions that are available as we work through how you complete, which may respond to the question. Okay, if there are no other questions that I need to respond to, we'll move on to having a look at completing the DSPT questions themselves. So you've registered, you've set your profile, you can then click through to the questions. And a couple of things that are worth knowing before you complete your DSPT. The first point is that it is a self-assessment. So your answers are not published. It is for your organisation to assess your systems and processes against the questions and then respond as a way of confirming for yourselves that you are compliant with the requirements under GDPR and cybersecurity, etc. So your answers are not visible to anyone. All other people can see is your DSPT status that you have achieved based on your self-assessment. But it is also really important to remember that even though other people are not checking your responses, it's not a tick box exercise. That you need to use the DSPT to work through and to verify for yourselves that you are compliant with the various legal and regulatory requirements. So it does rely on your integrity. And the whole purpose of the DSPT is, in essence, that you use the questions and comments to record the information to help your organisation in the future. So what do you actually see if you register as a social care organisation? So you'll see the social care assessment that looks like this. And you can see that in the dark blue bar at the top of the lighter blue box, there is three tabs available. There is assessment, report an incident, and admin. So the admin tab is where I was indicating that you can add other users, and that's where you would also be able to access your organization profile in order to update or amend that as you work through. The assessment is what we're looking at the moment, and then the central tab, report an incident, is a direct line through to the Information Commissioner Office. So should you experience a reportable data breach, then this gives you a direct line through to the Information Commissioner to facilitate that process. So underneath the blue box, we can see the heading Staffing and Roles. And you'll see there are a couple of questions on the slide there, 115 and 211, with the blue text, and you'll see that they're marked mandatory. So the box above indicates that if you answer the mandatory questions, you will only be able to publish at approaching standards. Now, to move through the questions, you need to click on the blue text as indicated on this particular slide, which will open up the box and show the full question and give you the opportunity to respond to that particular question. So it will contain detailed guidance and it will give you an opportunity to click. So if you click on that in order to see the full question, you will then be able to access the guidance as well as links that are available through to further information, etc. So how does the DSPT work? Well, it's divided into 4 headings, as we can see here: staffing and roles, policies and procedures, data security, IT systems and devices. And within each of those, there are a varying number of questions. If you're only going to answer the mandatory questions, then you can see there are 26 questions in total. And if you're going to answer all of the questions to achieve standards met, then there are actually 43 questions, although it says 42 on this particular slide with the additional question they've answered. So within each of those sections, the staffing and roles section asks about having, can we just go back one, please, Rihanna? Thank you. The staffing and roles section asks about having a named person responsible for this area and that you have appropriate training in place covering data security and protection. The policies and procedures section asks about being registered with the Information Commissioner Office, having data protection policies in place, having a retention schedule for your personal and confidential information, privacy notices, etc., and what you do with data once you're no longer required to retain it. Data security talks about building and physical security in place for paper records, what would you do in an emergency, etc., and how do you respond should you experience a data breach. And IT systems and devices talks about having basic IT best practice in place, things like antivirus software, etc., and whether you use external IT support, etc., etc. So each of the sections will cover specific areas that relate to the overall requirements of the National Data Guardian's 10 data standards and GDPR, etc. And so if we have a look at how the questions work and have a look in a bit more detail, so we can see that the questions cover who has responsibility for this area of work. So it asks about your information governance lead and whether or not you have those roles that the organization profile was asking for, your staff records and contracts, data protection and cyber security induction and training, etc. So if we have a look at the staff records section a little bit, we're going to talk through one question as an example. So it's important to keep up-to-date records of both staff and volunteers if you have them and the roles that they fulfill. So the first of the questions is, does your organization have an up-to-date record of staff and volunteers if you have them and their roles? So who have you got? What do they do? Now that may seem like a bit of a redundant question. However, it's important that you understand who you've got and what they do in order to be able to determine the various levels of access they have to the personal and confidential data that you have, because they should only have access to the information that they require in order to fulfill the role for which they are employed. So you don't have to upload the records to the toolkit, but you do need to have them in place. And in the toolkit, you can use the comments box to describe where the records are kept. So it's a tick box question, so you would tick the box and then indicate in the comments box where that particular record might be kept. So if we have a look at where this particular question sits in the toolkit, it's question 411, and you can see it's at the bottom of the staffing and roles section. And you can see it is also a mandatory question. So click on the box, it will open up the full question. You can see, as I mentioned, it is a tick box up on the left-hand side there. So all you need to do to respond to the question is to check the box on the top left, enter in the comments box, if you wish, where that particular record is kept. And that can be quite helpful in case it's not you who's completing the toolkit in the future. And then to finish the question, all you need to do is to click on save, and it should show completed on the right-hand side of the question once you've done that. So if we just have a quick look at how you might respond to that question. So in the comments section, staff and volunteer registered are contained in the HR files, hard copies, electronic versions, so that's on Google Drive, portable D drive, etc., etc. Again, just as reference for yourselves and for anyone else who's looking at your DSPT, either within the organisation or in the future. So let's have a look at how the questions work in a bit more detail. So if we look at question 115, which asks, who has responsibility for data security protection, and how has this responsibility been formally assigned? So this relates back to what I was saying about setting the organisation profile and the information governance lead. So this is basically that person who carries the can for data protection and cybersecurity in your organisation, and where does it say that that's their responsibility? So we can see on the left-hand side there at the top, the bold text is the question itself. And then underneath that, we have the tooltip, which gives the best practice advice. And that's in essence what you need to know about responding and fulfilling your obligations in relation to this. And then the tooltip may well include links, which is the blue text just above the top box, which will take you through to Digital Social Care Hub website, where there is further information about the various responsibilities in data protection. So this is a text box response. So it's asking you to type your response into the top box. And then underneath that is a comments box, which you'll see is marked optional. And that's where you might put information for yourselves or for the organization. If you enter your response to the question in the comments box, the system won't recognize the question as being answered. So you need to make sure that where it's a text box response, you write it into the text box. Having done that, you would click on save, and the question will be responded and will show completed on the right-hand side. So if we move on to have a look at another question, we can see that question 321 asks about staff training. So have 95% of staff, directors, trustees and volunteers in your organisation completed training on data security protection and cyber security? Now that's really important because it would indicate that training on data protection, cyber security, etc. is not just a requirement at induction, but it's an ongoing requirement in terms of keeping updated and ensuring that people have the relevant and current information in relation to this. And I'm frequently asked about what training is available around this particular topic. So the Better Security, Better Care team have developed some really useful resources in order for you to be able to comply with this particular requirement. So quite excited about the free e-learning course that's available for all staff working in adult social care services in England. It's completely free and it's completely available to anyone without any registration processes, etc. And the training is easily accessible. It's a series of 15 to 20 minute videos that are case scenario based, and it will provide learning for all staff at what level within your organisation. And again, it is free. It is compliant with question 321 on the toolkit in terms of whether or not you've provided the appropriate training. And you can see on the right-hand side of the slide here that the 4 modules are data protection rights and responsibilities, how to keep data secure, what are the threats to data security that you might experience, and what to do around data breaches. So it covers all of the areas that you would need to make available to the staff, etc. In addition to the free e-learning course, there is also additional resources available on the Digital Care Hub. And there is the Manager's Discussion Tool, which is a particularly useful resource, which you might want to use to check people's understanding and learning from the training, etc. But there is also a multiple choice quiz that's available for frontline staff in order to check that they have an understanding that they need to have in order to make sure that you uphold the rights of the people whose data you hold and process in your organization. So they're really useful tools, both to check the learning and the application of the learning, for example, within your staff supervision, etc. So the tools and the support is available to you to be able to respond to the questions appropriately and to reassure yourselves that you are compliant with those various requirements. So let's move on to have a look at section 2, the policies and procedures section within the toolkit, and look at what the questions ask. So 12 questions here that are really at the heart of GDPR and data protection. So the first thing it asks is, are you registered with the ICO? So if in the UK, if you're an organisation that processes personal and confidential information, it is a requirement that you are registered with the ICO. So you need to check that you are, and the question will ask what your registration number is. In terms of your policies and procedures, have you got up-to-date data protection policies? Do you carry out audits and spot checks to ensure compliance? And then it asks about your compliance with the national data opt-out requirement, which is probably worth a mention because it is a relatively new requirement for social care organisations. And in essence, it asks about whether or not your organisation is aware of the national data opt-out, and if you were then sharing personal and confidential information for the purposes of research, do you comply with the requirements of the national data opt-out, which is to check the database to see whether or not the data subjects have opted out of sharing information for those purposes. It then moves on to ask about holding and sharing information. What have you got? Who do you share it with? How long do you keep records? Have you got a retention schedule that tells people how long you should keep them and what you should do in order to dispose of them once you need to? So what are your arrangements for disposing of records and equipment? And do you have a list of suppliers who handle personal information? So for example, IT support, care planning system software suppliers, IT support, accountants, DBS, all of the things where you might share personal and confidential information with. Do you know who they are, and have you got the appropriate arrangements in place, and do you know how to contact them? So let's have a look at one of the questions in this particular session, and we'll look at the ICO registration. Registration, as I said, with the ICO is a legal requirement, and if you want to check whether or not your organisation is registered, there is a facility on the ICO website where you can search the register and determine whether or not you're already registered. If not, you need to make sure that your organisation is, because there is a fine of up to £4,000 for failing to register. And so when you're searching for your organisation, it's not always obvious which organisation it is, because sometimes people are registered as the business rather than the particular location. So you may need to talk to your provider, etc., around how that registration process has been applied. So what does the question actually ask? It simply asks, what's the ICO registration number? And as you can see, it's a text box response. So what it's asking you to do is to type in your response into the text box. You may want to enter some comments in the comments box in terms of where your registration proof or evidence is, and then you would click on save. The registration number usually starts with a Z, and so it would ask you then to type that into the top box, as we can see on the next slide. So ICO certificate with our ICO registration number, and comments, the organisation was registered on the 18th of March. The certificate is displayed in the main office. So not complicated, not difficult once you're confident that you are registered and you know what the registration number is. If you want further support, or you might want to check your policies, etc., in relation to this particular section, on the Digital Care Hub website, there's a whole section of policies and templates that are available in relation to the approaching standards requirement. There are additional policies for those that are moving into standards met. So you can see there, for example, it's got your training needs analysis, your data security audit checklist. Remember, we were talking about auditing people's compliance, etc. This gives you a template audit checklist. And there is further information on the national data opt-out, should you want to check what that's about, including some cut and paste text that you can add into your policies and procedures. And then there is some recommended documentation available around breaches, reporting those breaches, mobile device assignment form, smartphone policy template, and a template suppliers list, which links to the point I was making about knowing who you share information with, etc. So again, all of the resources you might need are available. So moving into the third section on data security, what do the questions cover? Well, they talk about data breaches. Do you have a system in place to report data breaches? And if you had a data breach, what did you do? If you haven't had a data breach, it's perfectly acceptable to answer the question with a not applicable. So you would tick the box. It is a tick box question. So tick the box and write NA in the comments box if it's not applicable and you've had no data breaches, etc. It also talks about physical security and paper records, business continuity. Do you include data and cyber security in your business continuity plan? And do you then make sure that the plans will work by testing them, for example? So moving on to the fourth section, what do they cover? They look at people and their access to information. So this relates back to what I was saying about people only being able to access information that they require for the purposes of their employment. What's your password practice? Do you operate best practice in relation to passwords, etc.? What arrangements have you got for backing up your data, and do you check that those backups are working, etc.? How do you protect your devices, which might include a bring your own device policy if people use their own devices? What's your technical setup and support? So do all devices have antivirus software and up-to-date operating systems? And what documentation should your suppliers have in relation to confirming for you that they are authorized and accredited to be able to process your personal and confidential information? And then new for this year, there is an additional question, the one that I was referring to earlier, which asks about multi-factor authentication. So multi-factor authentication is, as I'm sure you're aware, one of the most effective ways to protect data and your accounts from unauthorized access. So you should be considering all the systems that can be accessed from the internet, such as email, digital social care records, or any other systems that you use, and checking what protection you have in place for those and whether or not multi-factor authentication is appropriate for those. And this question asks whether they are, and if not, it then asks you to detail the exceptions to that in the text box and to justify why they might not be protected such as you might have other arrangements in place. If you need further information, if you click on the link on where it says guidance on implementing MFA, Digital Care Hub has a whole wealth of information available to you there. So let's have a look at that in a bit more detail. So multi-factor authentication is simply a way to make your online account safer. So it requires additional steps before you can log into your system. Usually that's a text message, email, code, fingerprint, or authenticator app, such as Microsoft Authenticator. And it's the sort of thing that you're probably familiar with from your online banking or similar systems, etc. And indeed, social media will often require multi-factor authentication. So it ensures we keep everything safe by only allowing people who should have access to have the access to it. So in terms of what your organization should be doing about multi-factor authentication, what you should be doing is reviewing your current systems and speaking with suppliers to understand what is available, how it is protected, etc. And then identify any potential issues. So is there anywhere that's more at risk than others? So that could be staff sharing devices, logins, etc. And then you may want to identify where MFA isn't the appropriate response. So if you've already got other significant controls in place, and then decide on your organization's response to this. What is the most appropriate response? We want the systems to be usable. We don't want people to stop using them, but at the same time, we need to make sure that we hold on to the data and information that we hold. Any systems without MFA need to be checked at director or board level in your organization with the justification as to why. So there's nothing wrong with saying we don't want to use MFA, providing you can justify that you've got the appropriate measures in place. The main reason I'm saying that is because should you experience a data breach, you need to be able to show due diligence. So in terms of security versus usability, if we then look at a few tips in relation to that, remember systems must be usable. Adding too many layers may mean that people are resistant to using the existing system or find ways around it. So identify the appropriate level of security for each system you use based on what sort of information is it protecting, and within your organization, how usable do we need this to be? So implement MFA where it's appropriate and use the appropriate support available if you need it in terms of your LSO, software suppliers, or your IT supplier for advice. And again, if you need further information on that, Digital Care Hub will provide all sorts of information there, as we can see here. So on the Digital Care Hub website, there are sections on staff and workforce, IT and software suppliers. There is the guidance on document retention and disposal, improving your security, and what do we do about mobile devices, particularly when people are using their own devices. So you may want to contact your local support partner or visit the Digital Care Hub website, whatever is the appropriate response at the level that you feel works for you. So you're now at a point, having completed all of the questions, you're then able to publish at the appropriate level. So how do you publish your DSPT assessment? Right, so assuming that you're publishing at approaching standards, so you've responded to all 26 mandatory questions, if you scroll down to the bottom of the page, there will be a blue bar saying publish approaching standards assessment. What will then also happen is that it will ask you to complete an action plan to show how you will complete the rest of the questions. So it will ask you to download the action plan template and then upload that to the assessment, having responded to the questions within it. So the intention is that they want you to get to standards met to indicate that you are meeting all of the requirements, etc. So if you have responded to all 43 questions, then again, the publish assessment box will be at the bottom of the questions, and you can see that all of the questions have got completed on the right-hand side next to them. Important that you remember that what you're publishing is the fact that you have completed the questions. You're not making available the responses that you put into the questions. And then if you were unable to publish and you've got an indicator that there is a problem, such as this, it will highlight where that problem exists. In this particular example, you can see there are 2 questions highlighted, and in most cases, it's either that you've missed the question altogether, or that you've done something like type your response into the text box, into the comments box, rather than the text box, etc. But if you click on the link, it will take you through to the question to the particular question that has a problem, and you can correct whatever it is that's missing, etc. If you were a headquarters assessment, then there is a couple of differences there, that it will indicate at the top of the page where it says view branches. You can then click on that and it will drop down and list all of the branches that are associated with this particular HQ ODS code. And then you can tick on the ones that you want to link with this particular assessment. And then once you've completed that, check that all of those that you're publishing on behalf of have the same policies and procedures, IT systems, data security arrangements, etc. And if so, click on publish and it will publish on behalf of all of those locations or services. Should you need further help with the publication of your DSPT, again, there is guidance on publishing for the first time, and the link underneath that gives you the contact details for your local support partner. So once you've published, you may want to access the information that you've put into your toolkit, and you can very simply download an Excel file which will contain all of the questions and all of the responses that you've put to them by clicking on the download assessment button. Or if you wanted a PDF version of that, then all you would need to do is to click on previous publications once you've logged into the toolkit, where it will then show you the various publications. If it's the first time, there will be just one as indicated on the right-hand side here. And you will see that it says view details on the right with the top arrow. If you click on that, it will show you, it will give you access to the PDF summary of your assessment. And also worth mentioning at this stage, this is where you would access the certificate of completion that will demonstrate that you have completed the DSPT. So the second arrow at the bottom shows where you would download your certificate of completion for the DSPT. If you wanted to save your published DSPT as a PDF, click on Control P, and that will enable you to access the PDF. And then you can either print it by clicking on Print, or change it to save as a PDF and click on Save. So once you've published, what next? Well, I would suggest that what you need to be doing is sharing your DSPT status. Having completed the DSPT, what you're actually demonstrating to people is that your organization is serious about data protection and cybersecurity. So it's appropriate to tell your branches, registered managers, if you're a multi-site organization. As I said, download the certificate to prove it, put it up on the wall next to your CQC certificate, add it to your website. Increasingly, it's useful to include the DSPT completion within your bids for work, etc. So tell commissioners, tell your NHS partners, and tell your IT suppliers. All of those people, it's helpful to let them know that you know what you're doing about data protection and cybersecurity. So how do you actually then keep it all live? Well, as I've said earlier on, you can access your DSPT at any point. So you can go into your DSPT anytime and keep it up to date throughout the year. So should your organization experience changes, such as change of personnel, or indeed you go from paper records to digital social care records, you can update the DSPT, and that will make it easier when it comes to republishing. You can use the downloads to ensure managers and staff understand what's expected of them. And you can make sure that they have access to the information either by making them viewers of your DSPT, or again, having the printout of the documents, etc., available to them. But please remember that in order to make it real, the real thing is not the DSPT. Data protection should not be a once-a-year issue. The DSPT is not the end goal. It's about a safe and secure service upholding the rights of the individuals that you support. So I would suggest that you need to be encouraging data protection and cyber security by design and default, so it runs throughout everything that you do and that it is the norm in your particular organization. So what would we like you to do next? Well, if you haven't already done so, register on the DSPT. If you need support or feel that it's going to be helpful, contact your local support partner or the helpline. For large providers, contact the Digital Care Hub for any guidance or support you might need. Check out all of the guidance that I've indicated is available on the Care Hub, and then start to answer the questions, remembering that you don't have to do it all at once. You can dip in and out as often as you like, and the system will retain your responses. So there are a couple of links available there if you want to access better security, better care information. And I think at that stage, I'm going to stop and open it up to any questions that might still exist. Nothing coming through in terms of outstanding questions?
I think, Alan, that I've managed to answer any of them that came through during the session.
Brilliant.
Maybe just to expand on that first one, there are 3 different question formats. The first is that you just need to put an answer into the text box, click on to save, and that will show completed for that question. The second format is there's a tick box in the top left-hand corner. You need to tick the box, and then you can optionally also put a comment in, but it will accept the answer if you only put the tick in the box and click on to save. And the third is that you have 4 methods of answering. So there'll be 4 lines of blue text. You must choose one of those 4 options, answer the question on that link, and then you can click on to save. Once you've been into a question, it should show the word completed next to the question. If it doesn't show the word completed, there's something that you've missed about that question. So just hop back into it and try to identify whether it's the tick that you've missed, that you've got to put a comment in, or if you were uploading a document that you've attached that in that position.
Thanks, Claire. Okay, so if there are no other questions, we'd just like you once again to have a quick look at a few questions and give us your response before we close the session this afternoon. So if we can put up the poll, please, and then we can...
I'll just answer the question about dental practices just whilst people are answering that poll. I'm not aware of anything that is in place for dental practices specifically. A lot of the tooltips are included within the DSPT, the templates that are available. A lot of dentists and podiatrists and optometrists do use those, but there isn't a network of kind of personal support officers that I'm aware of for dental practices. So please feel free to use the Digital Care Hub resources online, but I'm afraid I'm unable to navigate you to a person that can help you with those questions.
Okay, so if you could just again indicate your responses to the various questions in the poll, we will then have a quick look at what your responses are in the interests of informing our future offers to you, and then we'll close the session. Okay, so 100% increased confidence, outstanding. In terms of publishing DSPT, 100%, again, brilliant. That means that we're doing something right. In terms of whether you'll contact your LSO, 57% will, 29% likely. So the majority of you will contact your LSO. Would you recommend the webinar? Yes, 100%. And where people heard about it, various places there, Digital Care Hub newsletter, website, local authority, and from the LSOs. So that's brilliant. Thank you very much for completing those for us. And then it just remains for me to say thank you for joining us this afternoon. And should you have any questions, we are contactable. And should you wish to contact your LSO, they will be able to help you with the actual completion of your DSPT in any way, shape or form you feel that's helpful. So thank you once again, and I wish you all a good afternoon. Don't think I've been called a lifesaver before.
I'm so sorry, Alan. My computer's giving me trouble closing the
Okay, no problem.
Thank you so much, everybody.
Yeah, I was intrigued, Claire, by the question about dentistry.
Yeah, he was saying, is there an equivalent to LSOs for dentists?
Oh, right, okay.
As for social care. I got a bit tongue-tied explaining that, I'm afraid.
No, it's just that I didn't see anything come up in terms of the chat. So it must have been in the Q&A.
Yeah, it was in the Q&A.